Hello everyone, I am Pooja AP, and today I'll be making a brief presentation on retinal image processing for the detection and diagnosis of diabetic retinopathy. So, diabetic retinopathy is a diabetes related disease that damages the retina, which is the light sensitive layer at the back of our human eye. Now, this disease is particularly seen when a person is exposed to prolonged high blood sugar, which remains unregulated and uncontrolled. When this happens, it damages the small blood vessels in the retina. Now, why this is very important or why it matters is because diabetic retinopathy is one of the leading cause of blindness that is observed in the working age adults, that is, which comes to working age adults. And if this disease is detected at an early stage, then we can prevent around 90% of the vision loss that has been encountered in the present day. Before we proceed towards what exactly this diabetic retinopathy is, let's just have a brief overview of the human eye anatomy. So, when it comes to the human eye, we can say that it is a light sensitive organ that enables us to see the surrounding environment. This can be compared to the normal camera in the sense that the image that is formed on the retina of the eye is very much similar to how an image is formed in the film on a traditional camera. On a traditional camera. So over here, the cornea and the crystalline lens of the human eye, they are equivalent to the lens of the camera, and the iris of the eye works like diaphragm of a camera, which controls the amount of light that reaches the retina by adjusting the size of the pupil. So the image that is formed in the retina is then transformed into electrical impulses, and it is further carried into the brain through optic nerves where the signals are processed, and that is how the vision is generated. So when we look at the human eye anatomy, it has got various parts. The first one is the vitreous chamber. So this chamber, what is it speaking about? This represents the inner volume of the eyeball where the eyeball is placed, and it maintains the proper pressure within the eye. Next, we have the sclera, this one. So sclera represents the outer covering of the eyeball, and it acts as a protective covering, and it is called the sclera. And it is the white part of our eyeball which we see. Next is the cornea. So we have the cornea over here. So the cornea is the part of the eye through which light enters the eyeball, and it forms the front part of the sclera. Followed by that, we have the iris. The iris is the dark ring-like structure of the eye inside the cornea, and inside the cornea, it is that part of the eye that provides color to the eyes, and it helps the brain to adjust the exposure of the light that is entering the eye. That is basically when light enters, the iris expands or it basically compresses to adjust the focus. Okay. Then we have pupil. Pupil is a small opening. This one, what we see over here, it's a small opening in the iris that allows the light to enter inside the eyeball. And again, pupil is controlled by the iris. Then we have the lens. So the lens is actually a lens which is made up of muscles, and it is placed behind the iris that allows the light to converge on the specific points inside the eye to form the image. Now this lens can adjust its focal length to allow light from all the sources to converge accordingly. Then comes the main part, which is the retina, which is the light sensitive tissue lining at the back of the eye. This contains photoreceptors, which we call it as rods and cones, that convert light into electrical signal. So the rods, which is sensitive to dim light and responsible for peripheral and night vision, and we have cones, which is sensitive to bright light and it is responsible for detailed central and color vision. Okay. And then we have the optic nerve. Optic nerve is the main part which transmits the electrical signal that is generated from the retina to the brain, where they are interpreted as images. So this is the overall structure. Then we have other part which is macula, which we will see further when we proceed in the presentation. Now, how exactly image is formed in a human eye is when the light first enters the eye from the cornea, The intensity of light, it will be adjusted by the iris by changing the size of the pupil. Basically, you will have muscles which pull, which expand or compress the pupil for focusing the light. It is then focused in the eye lens, which focuses it to meet the retina of the eye. Then the image will be formed on the retina, where the rod cells and the cone cells capture all the information about the object. Next, we have the optic nerve that transfers all the information to the brain, which then forms the image of the object that we are basically seeing. So, this is in brief about the human eye anatomy and how exactly image is formed in the human eye. So, now coming to what is actually diabetic retinopathy. As previously I told, diabetic retinopathy is a diabetes related eye disease that occurs when we have uncontrolled high blood sugar. And when this happens, it damages the tiny blood vessels, which we also call it as capillaries in the retina, which is nothing but the light sensitive layer that resides at the back of the eye. And this is what detects the light and it sends the images to brain. Now, what causes diabetic retinopathy is again high blood sugar. Over time, it damages the small retinal blood vessels, and these vessels, when this happens, it becomes leaky or clogged. And when it becomes leaky or clogged, it will have reduced oxygen supply to the retinal cells, and as it happens continuously, the cell dies. So, in advanced stages, what may happen is the retina grows new abnormal blood vessels, which we call it as neovascularization, which can bleed and thus scar the retina. And once a scar is generated in the retina, it is something which cannot be treated back. So, some of the symptoms that a person who is having diabetic retinopathy faces is blurred or fluctuating vision, dark spots or floaters, difficulty seeing in the night, or you can say the last one to be partial or complete loss of vision. This happens in the case of advanced stages. So, this is the difference what we see in a normal vision and the vision that is observed in a patient who is suffering from diabetic retinopathy. A simple sample image is what I've put over here. So now, next we will see what are the different stages of diabetic retinopathy, which I'll also be using as DR. So we can basically categorize it into four stages. One is mild, moderate, severe. Both mild, moderate, and severe we call it as non-proliferative. And the last one is the final stage, which we call it as proliferative diabetic retinopathy. And I've also put some sample images which was taken from one of the research papers which I referred. So when it comes to mild non-proliferative diabetic retinopathy, what we see in the human eye retina is small bulges. Basically, we call it as aneurysm. Aneurysm is a bulge or a clogged artery. Small bulges, which we call it as microaneurysm, and this appears in the blood vessels that run on our eye. Next, we have moderate or non-proliferative diabetic retinopathy. Here, some of the vessels, that is the aneurysms that was created, that gets blocked, leading to reduced blood vessel or blood flow. Next is a severe stage where many blood vessels will be blocked and the retina becomes deprived from the oxygen. And the last one is a proliferative DR, where once this is done, you have new abnormal vessels to be blood vessels to be formed, which may bleed into the eye, and this causes vision loss. And once this happens, it is irreversible. So that's why we call it as normal to moderate range, and then it is the critical range, which is severe and proliferate. You can see over here, which is a condition that happens in vision loss. So now, why automation or automated detection of diabetic retinopathy is essential is because manual grading is time consuming and it is also subjective by nature. So if this process of detection is automated by using a technology like image processing, this will help the doctors for early detection, consistency, and also scalability. So, how image processing is used is it is used to analyze retinal images automatically and thus assist or help the ophthalmologist to perform diagnosis over the patient. So, for capturing these eye images, that is the retina-based images, we have various clinical method, fundus photography, then fluorescence angiography, and then you have optical coherence tomography. So, currently in the discussion, I'll be focusing on fundus photography. So, what exactly retinal fundus photography is basically a non-invasive procedure where we have a special camera that is used to take the detailed picture of the back of the eye. And that back of the eye part, we call it as fundus. So this image, it shows the retina, the optic nerve, and the blood vessels, which helps in diagnosing as well as monitoring the various eye condition. So what exactly this image shows is retina, macula, and the optic disc. Retina will be the, as already spoken, the light sensitive tissue at the back of the eye that sends the signals to the brain. Then you have macula, the most sensitive part of the retina, which is responsible for detailed central vision. And one more is the optic disc, the spot where the optic nerve connects to the retina. So we get the detailed analysis of these three portions of the retina using the fundus photography. So, what is the uh, role of image processing is what we have over here. Image processing is used in diabetic retinopathy, as I already told, for automated detection and also to grade the disease by analyzing the retinal fundus images. This process basically involves primarily three stages: pre-processing, which is used for improving the raw image quality. Then we have extraction of features like the blood vessels, exudates, and microaneurysms. And finally, we have the classification model. Often, in accordance with the current trend, we will be using they are using deep learning based neural network models to diagnose the condition. And the final output that we get from this processing is going to aid the ophthalmologist to make the diagnosis faster, accurate, and potentially saving the patient's vision. So the image processing workflow will just go on a brief workflow of what will be the different processing stages. Excuse me, different stages over here. The first stage we have is the pre-processing. Pre-processing, basically the raw retinal images are often very unclear. So we use various pre-processing techniques to enhance the quality of the image. So primarily it is used for removing the noise and improving the contrast, enhancing the specific channels, and removing the optic disc. So for removing noise and improving contrast, algorithms like contrast limited adaptive histogram equalization is used for enhancing the specific channels. This is done because it is very important to extract the green channel from the RGB, which basically highlights the lesions and the blood vessels more clearly. So for extraction of green channel. So yeah, that's what I said. It basically highlights the vessels. And then you have the removal of optic disc. This optic disc is removed in order to avoid the confusion with lesions that have got similar appearances. Some of the techniques which are used for performing the pre-processing algorithms basically are CLAHE, which I already told. Then you have Gaussian filtering and green channel extraction algorithm. All of these are some of the most widely used pre-processing techniques. Then followed by that, what we have is segmentation. So, due to on performing pre-processing, we get a very clean image so that the blood vessels and the lesions, they stand out clearly. Now, segmentation is basically used to separate the blood vessels, optic disc, and lesions. So here you have vessel extraction and lesion segmentation. For vessel extraction, we have specific vesselness filters that are available in, it's one of the image processing techniques, which is used to enhance and segment the retinal blood vessels. Then we have the lesion segmentation. So this process, it basically identifies and it isolates the pathological features like microaneurysms, hemorrhages, and exudates from the background. So for doing this, the various techniques that are used is thresholding, edge detection, morphological operations, and unit. Then we have the next step that is done is feature extraction. So feature extraction Feature extraction basically is used for extracting the various features from the already pre-processed and segmented images. So this is done for performing quantitative analysis. That is, we use algorithm for extracting quantitative features which are identified from the lesions and vessels. That is the measurable features which can be used for the diagnosis. Then feature selection. Based on the analysis, features are selected, and using this, it can be used for determining the stage of the diabetic retinopathy. So basically here we extract morphological features which represent the shape of the vessels and microaneurysms. Then we extract texture features which depict or give information about roughness or smoothness of the retinal regions. And also they extract color features which identify the exudates, which is the yellowish lesions that we see in the human eye. Okay, the technique that is used for this is Gabo filters, PCA, texture analysis, some of which that I have listed over here. So on doing feature extraction, we extract the measurable patterns from the image, such as how the vessel branches or how bright certain regions are. Next, followed by this, so when we have classification, so in the case of feature extraction, I would like to add few more points. We basically perform lesion detection over here. So there are different types of lesions. One is microaneurysm. This will be represented by tiny red dots. And the detection method, which is generally used for this, will be morphological filters. Then we have hemorrhages, which is the blood patches. And for this, basically blood leakage, we can say. For this, the detection method that can be used will be region-based segmentation. Then exudates. Exudates are yellowish spots that will be present in the human eye due to the leakage of blood vessels. So this can be for this they basically use various color thresholding techniques. And neovascularization, these are the new vessels which are formed. And for this, again, they use edge and sharp analysis. So each lesion, lesion type basically gives us the clue about the disease stage. So detecting them optometrically is a very important, or you can say, a key step in the diagnosis of diabetic retinopathy. So once these features, that is the lesion-based features, and are extracted, the next stage is classification. Classification is basically used for categorizing images as normal, non-proliferate diabetic retinopathy, or proliferate diabetic retinopathy. So over here, based upon the classification can be done based on the severity and also for automated diagnosis. When it comes to severity, they have used various machine learning models like CNN, and over here the ML model is trained on the extracted features to classify the images into various grades of diabetic retinopathy, or as categorizing them as healthy and non-healthy. Then when it comes to automatic diagnosis, this automated classification, it basically helps the ophthalmologists by providing a rapid and accurate initial diagnosis, which is specifically or especially useful in areas where you have shortage of specialists. So the techniques that is used is machine learning, in that we have SVM, random forest, and various other approaches. Then in deep learning, basically the CNN ResNet. So, what we can conclude based upon the discussion is that deep learning, especially CNN architecture, is used for analyzing thousands of retinal images and learn patterns that even on the rarest cases, experts also might miss. So, if you train the algorithm in a very efficient way, then it's going to be very helpful for the diagnosis. So, now coming to the uh, challenges. So there are various challenges that one experiences while diagnosing diabetic retinopathy. One is the uh, uneven lighting and image quality. Then some of the small lesions might be easily missed, and for this there is a need for interpretability in artificial intelligence. So also what may happen is these small visions, they can be easily missed because sometimes they will resemble or look like normal features. And also Need for interpretability in AI basically or largely depends on the data set. So the data set has to be accurate and large enough for performing accurate diagnosis and detection of the diabetic retinopathy disease. So now, the future directions. So over here, basically the future of this domain, it is there in the research from a very, very long time. So considering the current work, the future is based on developing mobile-based DR screening apps, 3D imaging using OCT, and federated learning for global models. So this can include a hybrid of ML and DL methods, real-time edge AI screening, as I said, DR screening apps over here, then explainable AI for clinical trust, and its integration with wearable imaging systems. So these are some of the future trends or future works that can be carried out in this domain. So what we can conclude from this entire discussion is that diabetic image retinopathy is not something that is not curable. It is easily preventable provided it is diagnosed early, and thus we can avoid the vision loss. Image processing basically plays a very key important role in automation, and if integration of AI plus medical imaging is done, this can lead to faster and more accurate diagnosis of this disease. Diagnosis of this disease. So I would this is in brief about the diabetic retinopathy that I discussed upon. There are various data sets already available uh, freely, using which research is continuously going on in this domain. What we can conclude at the end is despite the progress that we see, AI models still face challenges when working with poor quality images and subtle cases. So, thank you everyone. Thank you.